camera and or change your name on Zoom so it's not visible. And that said, welcome everybody. These are our bi-weekly town hall meetings. We've been having these every 2 weeks, and until just this week, we've been having weekly task force meetings with county and state officials and providers and community leaders, kind of talk about how to get the vaccines out and so forth. We're now going to every other week for those. So these meetings are open to both those groups, and hopefully they both came. I'm not seeing a lot of providers on tonight. They'll be meeting every 2 weeks. And that may go to once a month as things kind of settle down a little bit as we get more vaccines available and testing and treatment options get a little more streamlined than they were at the beginning. With that said, why don't we start with an update from the county? And I see Jose Arballo is on, and he can give us the latest and greatest on kind of the numbers, where we stand, and most importantly, the vaccination events that are coming up. Jose, take it away.
Yeah, thank you, Jeff, and thanks everyone for being here today. I am not as gifted in these updates as Misty and Dr. Shavinsky are, but I'll see what I can do. It's a pretty short update, actually. And one of the things, as in regards to the numbers lately, as you probably have seen, as you look up on the dashboard, numbers have been quite steady going up, single digits for the most part for the last week or so. We are also updating on Thursdays our vaccine numbers, our vaccine allotment numbers as well, so everybody gets a good idea of where our numbers are going. I know that they discussed the expanded criteria for MPX vaccine. I know, and I'm gonna add, and I think it's already been discussed at one point, the new criteria that was added with community input. The last item would be the category criteria includes cisgender men, transgender women, and non-binary people who are having sex, including chemsex, group sex, anonymous sex, or attending sex on premises events with other cisgender men, transgender women, and or non-binary people. Again, this criteria was added after some community input. I know that Misty and Dr. Shavinsky had talked about other categories as well. I also want to give an update on a couple of clinics that will be coming up tomorrow, Wednesday the 28th, at the LGBTQ Community Center in Palm Canyon Drive in Palm Springs. It is from 11 a.m. to 3 p.m. We do have walk-in appointments available. The patients must meet, of course, the eligibility criteria that I included, and that is, thank you, Jeff, for putting it up there. That's the flyer that's going around. It was put together today, and that will be, again, for tomorrow from 11 a.m. until 3 p.m. As for Saturday, during Idlewild Pride, there's also going to be a vaccine clinic as well up in Idlewild at Idlewild School on Saturday from 11 a.m. until 5 p.m. The same applies for walk-in appointments will be available, and they must meet the criteria. I know that they're talking several hundred potential vaccinations at that location. The same applies. Category 4, we talk about the high-risk populations that I just discussed, along with sex workers, specific healthcare lab workers, and high-risk close contacts. Thanks, Jeff, for putting that up again. I know there are there's some questions about eligibility, and I know as we say, and Dr. Shavinsky and Misty have said throughout, supplies are limited, but we are continuing to work with our partners out here to get vaccines out as much as possible. And with that, that is my quick update. I know there are probably any questions. I will be writing them down, and again, Misty and Dr. Shavinsky were not available today, so they asked me to do a quick update. So if there are any questions, I'll be writing them down and then passing them on to those two, as well as anybody else from the department who might be able to help as well. So with that said, Jeff, it's back to you.
Great. Thank you so much, Jose. I really appreciate that. Are those flyers available online yet somewhere? I can post it.
We'll be putting them up online tonight or tomorrow morning. And
Okay.
they'll be on our website. They'll also be we'll be pushing them on social media as well, on our Twitter and Facebook accounts.
Terrific. Thank you. And we did post the Monkeypox website and MPX website, they call it now, in the chat there. So you can check there tomorrow and that should be up. And if anybody needs the information to share with their networks or anything, just shoot me an email and I'd be happy to send that to you. Because obviously with the one at the center happening tomorrow morning, we need to be getting the word out. But do we have a sense of how many vaccines are going to be available at each event?
I know with the one in Idlewild, the number is in the hundreds. As for the one tomorrow, I know it's quite a bit less. I without specifics, I don't have that exact number. But again, the one in Idlewild, they're expecting obviously a lot more people.
Great, thank you. Other questions or comments for Jose? It's a question in the chat. Can you provide this data? Oh, here we go. And here's his questions. And some of that, Terry, is on the website. And then, but yeah, I think normally what Misty does each time is gives an update on how many they've received, how many they've asked for, how many they've received, and so forth. Do you happen to have that data at hand? Or
I don't have that data in hand, but the last number, it was 4,000 something that she was given still applies from the last update that she gave on Thursday. And I apologize, I don't have that number handy off the top of my head. But she did say that we'll be getting an update tomorrow. We'll be when we update the website on Thursday, that number will be included there.
Okay, good to know.
And again, that we do update that on Thursdays, every Thursday.
Great. And this might be a Dr. Chavinsky question, but anecdotally in the community, and I think some of us may have experienced this, when people have gotten the intradermal shot, they're experiencing a lot more side effects. And those of us, myself included, who've had the sub-Q shot originally, and then 28 days later got the sub-Q shot, had a lot more reactions, fever, chills, achiness, night sweats, that sort of thing. So are you hearing that at all?
No, and I can tell you, Jeff, that I'm involved in all the briefings that we have, and that is not something that's been come up. I will ask specifically about that, but in all the discussions we've had about vaccines, our almost daily updates, that actually hasn't come up. So I will make sure to ask Dr. Chavinsky about that.
Okay, I appreciate that. Yeah, and if we get to hear from any providers tonight, we can ask them as well.
Can I ask a question?
Please go ahead.
Hi, Jeff. Can you clue us in to what the data is on the county wait list? How many people are on that list? How many vaccines have been administered? How many you've done in the last couple of weeks? That kind of thing.
Well, I know, Terry, and I appreciate the question. I don't have that number handy. I know that we have it on the website. Part of it's on the website. And again, it would be updated on Thursday to have the more updated number. I can tell you that we have, as always, trying to get as much as we can, but I have not been told anything more than what the number that we had from last week was 4,000. I want to say 4,600 was the latest number we had that we had received, but I do not have a newer number than that. And as for how many have been on the wait list, I have not heard that wait list number in a while. One of the problems we have is we have people that do the multiple submissions, so that the number that we have is not accurate, in the sense that we have multiple people that are giving multiple applications or interest forms, so that if it's our list might, let's say it's 10,000 people that is on that list, quite a number of those are duplicates. So what what I'm going to do is I'm going to talk to our epidemiology group and see if they can give me a better number, pulling out the duplicates and see if we can get a better idea of how many on the wait list. I know that we've been reaching out to those that are now eligible, given the new criteria, to invite them to go to the clinics from that interest form, and we are reaching out to them as well. But again, that exact number I don't have.
Have you fixed the issue of there being no confirmation when people sign up? They get nothing in response, so they don't know if it went through. That might be prompting a lot of people to sign up more than once. Right,
and I know that our IT team was trying to put something together to address that. That was from the last meeting that I remember as well. I have not heard back from one of our briefings that issue has been resolved or not. But I will as well reach out for that, reach back to Misty and Dr. Sabinsky about that.
Do we know, just to follow up on that, do we know how many people they've invited to be vaccinated and how many have?
No, I do not have that number. I can tell you that the number that we have of people being invited, I don't have that handy. I will find that number as well.
Okay, and is there somewhere where you're listing all of these upcoming vaccine clinics?
We are going to be putting our website together. At this point, we're discussing putting our vaccine clinic information for both COVID and for MPX together, so that we have one location for the public if they want to do their vaccine either from the MPX, but we're still working on that as well. That new website should be available soon.
In some of these clinics I've heard about after they've happened. And if you want to utilize them to their best effect, you kind of need to advertise them and let people know ahead of time.
No, absolutely. I think one of the things that we do, and we provide, we share as much information as we can with our community partners, and those that get invited as well. I know our community partners also have an extensive list of people who may contact, and we're working with them to get the information out as much as possible. We also have it on social media as well, and also we have our websites that we are also promoting on with the flyers as well.
These community partners, are they anything more than the providers who only deal with their own patients? Are you sending them to organizations that have email lists and
yeah, we are actually. We do as well. Our community partner list is quite extensive when it comes to not only some of those community partners we were using for our vaccine clinics and our other communication for COVID. So there's an overlap there as well.
Well, by way of feedback, I've never received any information about any of these until generally from friends or after they've happened. And I'm on a lot of lists. I've never received any information. So other than the provider who I have, they've contacted me through their process of distributing their own vaccines to their own patients. And I guess I'm saying that there seems like there's a hole there. Nobody knows when these are, and they don't hear about them until they're on the news. And I hear friends saying, gee, I wish I had known. I would have gone.
Well, no, I appreciate the feedback, and I know that we are always reaching out to as many people as we can to get the information out. I know that I was out at the clinic last week, a week and a half ago, and there seemed to be the same issue, people finding out late, and we're working on that as well. We're always looking for ways to improve communication. So I appreciate the feedback on those.
Yeah, this is Jeff, just to kind of put a finer point on some of that. You're quite right, Terry, that, until now it's been the community partners, and DAP has done several of these, and their priority, not surprisingly, is DAP clients. So they want to get through everybody that's eligible in their and so what's happened, and I think this is what happened at last weekend's vaccination event at the convention center, is that once they went through that list or had a lot of no-shows, then they started spreading the word. And that's why, you're getting text and it's showing up on social media, and sometimes you don't see it till after the fact. So to my understanding, this weekend's event in Idlewild is the first kind of broad-based, and this is county-led, correct, Jose? This is not,
That is correct.
so, open to anybody. And now that we have the flyers, we can let people know ahead of the fact instead of after. So things are changing. And I think the change to opening the criteria to phase 4B, where any MSM, all people living with HIV, correct me if I'm wrong, Jose, and people who are sexually active, MSM and trans folks who are active will qualify now. So that opens up considerably. And so it's not, the sponsor of the event like DAP or the one at Oscars was QueerWorks, trying to make sure that it was limited only to people who met those criteria and prioritizing their own people first. So I think we've kind of entered a new phase, not only in eligibility, but in how these things get advertised and disseminated. So hopefully that'll.
And can I add, when you reference DAP, they generally only deal with their patients, not their clients. They're two different.
Correct, yeah,
medical.
thank you for clarifying, yeah.
So, yeah, so I happen to be a client. They don't contact me. I did happen to get an email yesterday with an outdated criteria on about an upcoming survey, asking people to contact them. It's the first time.
Mhm.
Good, but up till now, they've just been addressing their own medical patients, not their clients. And the clients all have HIV and I think should be prioritized.
Mhm.
And kind of an oversight. And I'm saying that so the county hears it. They need
Yeah.
to know that they're relying on some partners who are just serving their own patients and they're not reaching out to the community. And I think they're being relied upon to get the word out. In fact, they're not. So that needs to be addressed.
And Jose, you mentioned the social media where things probably get posted faster than on the website. Can you share those links in the chat for us?
Yeah, sure, I can do that. Absolutely.
Yeah, appreciate that. And
Thank
then
you.
I see Kevin has a question. Go ahead, Kevin.
Thanks. First of all, I want to thank Terry for all the comments and the questions. I think he's spot on. I sit here as my husband is HIV positive and he's been contacted to get his monkeypox vaccination later this week. I'm just a regular Joe who I submitted the form. I have no clue where I am. I have no clue on how many forms you have. I see in the chat window here that other people have submitted it several times. I think it is absolutely urgent that the county distribute this information that Terry is recommending here in some sort of a report, so that we know whether there's where we're at on the list. And we really need a confirmation that we're even on the list. I've called Riverside County 3 times. I've talked to 3 different nurses and everybody says, can't tell you that. There's just no way for us to know. Well, that I think you need this feedback. You need this feedback to help us all in this community. And so thank you, Terry. Thank you, everybody, for the comments, but really we need more. We're still starving for information. Thank you.
Great, thank you. And there's a question in the chat from Paul saying that DAB called us and said we cannot get a vaccination until having an STI screening testing. There's no reason to assume we might have any STIs. Why would they be requiring that? Seems rather strange. Friends tell us they got a vaccination via a walk-in. What's up with all of this? Thanks. Jose, I'll let you.
Well, I can tell you from what I witnessed at the Oscars. I was at that clinic, and it was as is tomorrow's and as is Saturdays. If you arrive at the clinic and you confirm that you are you meet the qualifications, there's no other requirement than to say that you qualify. I know there's no requirement of any other testing or anything like that, so no records, no documents that you need to provide. So I can't tell you why someone would be required to do something else. Again, at our clinics that we have, like I said before, when it's a walk-up, you have to self-attest to that.
Yeah, and I think that might be because until phase 4 just got opened and they broaden the eligibility criteria. Having an STI was one of the eligibility criteria. So I think what they were trying to do there was to get you in, get you tested and see if you had an STI or evidence of one, and that would make you eligible under those prior criteria. But as Jose just explained, that's changed, so it should really simplify things. So, but yeah,
I can
explain why
yeah.
they're asking for that.
Yeah, I can also say that's the same eligibility that we used at our clinics, our vaccine clinics for COVID as well. It was self-attestation. You did not need to provide any type of record or test result to get vaccinated at one of our locations.
Can I
Please.
say, I just wanted to make sure you know that in the chat box, I inserted a request for different data from the county. It would be really helpful to have that every meeting that someone from the county comes to without us having to ask. It's basic data should be presented. We shouldn't be relying upon outdated data from last week. It should be up to date to today. And it should be specific so that we know what's changed from the prior meeting 2 weeks ago to this one. The one that you've been having on Thursday, I don't know who's invited to that. I have not been. I haven't been able to go. So it sounds to me like it's mostly providers talking to themselves in the county. And Jeff, correct me if I'm wrong, but this is the only meeting where the public has an opportunity to participate and to ask questions, and also to get some accountability.
Mm-hmm.
And that's been really lacking here, accountability.
So to your point, I will be, this email you just sent me like an hour before the call, I will be sharing that with Jose and the county folks so they can include that in their reports on these calls. And the task force meetings, you're right, they do meet every week, and that is providers and the county, so they were started just like we did at the very beginning of COVID, so they get information on how to get access to testing. There were a lot of issues with that. There were a lot of issues with getting access to treatment, the TPOX that people need for treatment if they do get monkeypox. So there are all kinds of logistical issues that they needed to work out. So that's what those calls were for. And now that we've ironed a lot of those issues out, and it's more about getting shots in arms like we're talking about now, those meetings are happening a lot less frequently, and they've been invited to this call. And I'm kind of chagrined to see that I don't see any providers on here. Hopefully I'm wrong. To share updates from theirs. I think they thought that the problem was solved, and they don't need to show up with these. They have in the past, but
that's very concerning.
Yeah,
it's very concerning.
So somebody had asked when the eligibility criteria opened up. Was there a date on that? Was that just this week or?
Well, I know last Thursday, I think was when we announced it. So I know Dr. Shavinsky was on the Thursday call, and then we revised it to add the last, or to clarify the fourth group would have been yesterday with the verbiage that we have. Yeah.
So yesterday officially is when it went in.
Yeah.
Thanks.
Are you sending that out to an email list so people will know?
Well, I know that, again, I know it went out to a lot of the partners that we have, because I saw the email go out today to our partners that we're using. And I don't have that specific listing with me, but it did go out today.
I think
as well as the flyer, and as well as other information that as well, the flyers that have the new information, as well as information about the vaccine clinics that are coming up.
Can I suggest that
I was going to interrupt just for a minute, Terry, if I could.
Yeah.
To make one suggestion that might address a lot of the issues that have been coming up. But you've got the vaccine interest form, and now that the eligibility criteria are broadened, maybe sending that information to everybody on that list, saying, you're on this list, so people know they have confirmation they're on the list, and they have information about the walk-in clinics that they can now go to, would be, I think, a huge help to the community, because as you can hear from the frustration on tonight's call, people feel like they're in the dark. So if the county could do that, I think that would be a huge help to address a lot of these issues.
Exactly what I was going to say.
I understand what you're saying, Joe, but the one thing that doesn't change, regardless if you're on the list or not, is if you're not eligible at this point, you're not going to get vaccinated. And I think that's part of it. I mean, that's to say that to do a letter to people that on the list that are not within that criteria, that would be a little misleading to say.
Well,
that
I think
can
you
do
say
one.
in the letter what the criteria are.
Yeah,
and if you
right,
meet the
right.
Criteria, you come to this event, but
Yeah.
that way at least people know what's going on, because you're
Yeah.
hearing there's so much frustration and anger in the
Sure.
community that they don't have that. So if we could, and whom should we talk to about that? We can certainly follow up with,
Well, I think Misty's the one that we're going to be working through, and she's again
Okay.
in fact, I know Dr. Shalinski and her plan on being on the Thursday call, and to provide more updates as well.
yeah. So we're not having, as I stated earlier, we're not having the Thursday call this week. Those are going to every other week, and these calls are taking the lieu of those. So we're bringing everybody together, the county officials, the community, and providers to share that information, because, I got a call from Misty and Dr. Chavinsky couple last week, I guess, saying they're just overwhelmed now that they're doing all these vaccine events. They can't be on all these calls too. So we agreed to do that. But what I will do is send them an email with that suggestion, with Terry's
Sure.
suggestion.
No, I think that's a good idea.
Yeah.
If that can be done, I think more of it is a matter of connecting the desires that we have to try and get information out with the realities of IT and the ability to have information shared. And you want to make sure that you're being respectful of people's privacy and also other issues that we don't want to make a mistake. So we want to be clear when we do this, when we're pushing back information, that we're not inadvertently providing more somebody's information to somebody else. So, but I appreciate it, and reaching out to Misty would probably be the best way to go on that one, Jeff. Thank you.
I'll make that happen. Thank you. Sorry, Terry, I interrupted you. Did you have anything else?
Actually, that was exactly what I was going to suggest.
Okay.
Also, I had a lengthy conversation with Juan Landeros after our last meeting, where we went over a lot of these very things, issues with their form, issues with confirmations, issues with communication, issues with outreach, with advertising, with notice, with not keeping the public in the dark like we are. And at least up till now, very little of that has been incorporated. I think you need to hear, Jose, if you haven't already, that there's enormous frustration that's bordering on fury. It's furious. People are angry they have to go to LA County. People are angry they're not hearing from their own county. You've gotten people to sign up for an interest form. There is something between not communicating at all and providing some information. On the interest form, you can have a checkbox. Do you want information on this? Would you like us to contact you? A standard procedure.
I can tell you, Terry, there is a notification on there. We get a newsletter that we're putting out every other week as well. That there is a button you can push on there or click on there to get that newsletter, which is has some of the same information you're talking about, from criteria to clinics as well. And that, I know that right now that newsletter has in the neighborhood of 4,000 recipients on it. And every person that signs the interest form has that ability to register with that.
Okay, and that's how I must have gotten it. There isn't the linkage between, oh, gee, they're acknowledging that I signed up, and they're telling me there are these changes and to be prepared, that criteria are changing, and that there are going to be these pop-up clinics, so I should watch for them. And when the clinics are scheduled, nothing is being sent out to notify people. So there's this feeling of just chasing after something that's moving faster than we are. And most of us in the gay community are aware of what's going on elsewhere. We know that Folsom over the weekend had thousands and thousands of doses in clinics up there, thousands. And they're a county not unlike Riverside that is not in, that is in the state pool, but they got a special dosage supply because it's a big event, which we're hoping is going to happen for Leather Pride here and Gay Pride here. So we all hear about this, then we look at Palm Springs and say, where are they? Why are they so quiet? They seem to be patting themselves on the back, that they think they're doing a great job.
Terry,
And
can I interrupt? Because some of these
Yeah.
supply issues come from the state. So they're the ones who determine how much the county gets.
I'm
And
sorry,
we have
but
someone
that's,
from the ADPH on, we should probably hear from them first. If we
that's
could.
only half of the decisions come from the state. There are two supply streams that come straight from the CDC.
Right.
One is pride events, another is big events, big gay events, like Southern Decadence, those kinds of events, Folsom. And the other is, there is a special supply chain for cities that have been designated popular national gay resorts, which Palm Springs for some reason has not. So we know that Provincetown did. It's a town much smaller than Palm Springs.
Yeah, I think
Equally
Terry wants
seasonal.
to, I think that Jose wants to weigh in on that. If you could let him speak.
Okay, good.
Well, no, I'm going to double check with Misty, but I remember hearing that gay designation, and that my understanding again, and I'm going to check with Misty, but that just is not the case.
Yeah.
I'm going to double check with that, but that just isn't the case as far as I know. And I know that we've been, and again, during our briefings, the issue comes up about Leather Pride and also the events that are coming up in November. The biggest issue in that special event criteria is that they are providing the supplies. They don't want to be so far out to do it now. They're waiting closer at this point to the event. And again, obviously, that is something we would hope that we'd be able to vaccinate large sums of people long before the event, so that the protection is there when they actually have the event, rather than that event itself. So that's a hurdle we're trying to climb over, and that's something that, again, that we're working on to try and get more supply here. But at this point, that's just not the case.
And then to address the issue that you raised, and then I'll get to Kevin, who's been patiently waiting. Sorry about that, Kevin. The designation of places like Provincetown and Fire Island, those were not from the feds, from the CDC. Their state governments allocated those before the 4th of July weekend in both P-Town and Fire Island. So, because I was trying to track down that information as well and got confirmation that it wasn't from the CDC. It was, so their states recognized, that they're unique, that they could become super spreader locations, and those weekends especially, and acted proactively. And that hasn't happened here. So we can, ask more questions about that in a minute. But I do want to get to Kevin, who's been patiently waiting. So go ahead, Kevin.
Well, thank you. I just wanted to add a comment here, and frankly, it's about 5 minutes old. But just so everybody's aware, if I've put in on my vaccination interest form, I've given you my email address, I'm receiving your newsletter, which just really is a repeat of what's on the website and what's being said on the video calls. The disconnect is the people who have filled out the form do not know where they stand. And anybody with basic database skills can generate an email that just says, hi, we have your form, you're on the list. A slightly more educated database administrator could send something out that says, hi, you're on the list and you meet the current criteria. That's not hard, because we check the boxes when we do the form. This is not rocket science. It is basic database skills. I can't believe that the county can't do that. So please get the message back to the IT people. You need to communicate to the community. I cannot emphasize that enough. We've been flying blind for months, and it's got to be, we need help here. We need to at least know we're out here. Thank you.
Great, thank you. And there is one comment in the chat I want to make sure gets addressed, is now that the criteria have changed to all HIV positive people, will we still be required to go to an appointment only, says PR events in a public space, or will we be able to maintain our confidentiality by going to our regular clinic where our risk factors are already known and our confidentiality is maintained? And I'll let Jose address that, but I think the short answer is it all depends on who your provider is and how much vaccine they have.
Yeah, I think that's absolutely correct. Well, one of the things I know for when we do our clinics again, and we're going to be doing more of them, we make every effort to protect the confidentiality, plus limit in the questioning when you come in to basically register at the location, basically asking, do you meet one of these criteria, without getting into any specifics as to which one of the criteria is involved. I think that's we're trying to be very sensitive to that. The verbiage that we're using is something that, again, without getting into specifics while you're in line registering, you just basically have to say that you meet the criteria. And your confidentiality as to why or how you meet the criteria is not something that we obviously, we want to protect that.
Yeah, and I think until this week, that was a really valid concern because the criteria were you had to be a sex worker, you had to have had an STI recently, or be going to group sex events. So just showing up in line at that, I could totally understand would be kind of outing yourself as somebody in one of those categories. But now that it's been broadened considerably to anybody living with HIV and any MSM or trans person who's having sex with other MSM or trans people, I think it's a lot less stigmatizing, hopefully, and people will feel more comfortable. But if you want to go to your doctor, you can, but it's going to be dependent on what their supplies are, because like everybody else, they get limited supplies and they go through them. And if they haven't vaccinated their highest risk people yet, people who are at less risk may have to wait. So, but now you at least have an option to go to a public walk-in event and get that if you feel you need it.
Jeff, I wanted to address one thing for Kevin. I appreciate your comments about the newsletter. I wanted to let you know some of the people on the call or on the newsletter that receive it are not on the calls that we have here. So that information is fairly new. However, I do appreciate what you're saying, because we do take a lot of basically recycled information, use it, but we're going to try and do a better job of giving you newer information. And then again, as we build up more clinics, the information about the clinics, as long as it's timely, hopefully will be included in the newsletter. So it'll be a little more useful for those who are not on these types of calls, but also who have just submitted the forms and are going to be getting the information for the first time.
Great, thank you. And as I mentioned earlier, just so people understand how the process works, the county gets their supply from the state, which gets a federal allocation. And we do have someone from the California Department of Public Health, Tiffany Woods, is on. So Tiffany, perhaps if you'd like to unmute and perhaps say something about kind of how that all works and address any of the issues that might have been raised thus far in the call.
Hi, Jeff.
Hi.
Thanks. Hi, everybody. Yeah, and I do have to leave by 7. So I do want to address the CDC Pride that came up. Yes, San Francisco had their events. They were selected by the CDC White House Initiative for their Pride events. That initiative was very clear from the beginning. They wanted to be 2 to 4 weeks out. And so that's why Oakland Pride got selected and San Francisco got selected. However, we have reached out on last Thursday. We asked the CDC if they would revisit Riverside, because the original issue was that you were so far out.
Mhm.
And that pilot project was very clear. No matter how many times we went back and forth and advocated, they were very clear. It was 2 to 4 weeks out was the way it was designed. And that's why they were prioritizing Southern Decadence, Atlanta Gay Pride. So we reached out to them and they said, yes, you could resubmit it if you'd like to resubmit the proposal. So we reached out, Eric reached out to the county on Thursday and asked if they would like to resubmit the proposal. And, we'd be more happy to resubmit it with them and work on them and submit it. We're waiting to hear back. And that was literally on Thursday. I just looked at the email chain just to make sure. So we're waiting to hear back from Misty and Kim and how do they want to proceed? Because we're ready to move resubmit the proposal and work with you all and advocate.
Yeah.
As far as the allocation requests, the state's been down for the last 2 weeks. We've not been getting a lot of requests for any of the reserve doses or any other allocations beyond regular allocation doses that counties are receiving. So we're a little bit like trying to figure out also what, I know case counts are down, which is a good thing. So we're just also trying to figure out like what's going on in the communities. Why all of a sudden we've just kind of stopped getting requests for extra doses. And we have the other additional CDC project, which we sent out the county emails all last week. It's a very limited but much smaller events and special events prioritizing our community. And we haven't got a lot of requests. We haven't got a request from Riverside, and we haven't got a request across. We got one from like Mono County. We've got inquiries from other counties, but nobody's actually, it's a really simple request and nobody's requesting. So we're not sure what's going on. We also will have our last September stakeholder listening community session tomorrow. It'll be 10 a.m. at 10 to 11 in the morning. I will drop the link in the chat. It's open to anybody. It's 1 hour. We'll do an update, and then we'll do a 30 minutes question and answer. And
Great.
we will be able to respond to any questions as possible. Marissa will be there, myself, I'll facilitate it like we normally have been doing. We did the last one was on the 14th. So we invite you all to come in and get updates from the state on the latest epi. And we are also have been really switching to equity and updating our data dashboards to make sure that we are addressing equity issues that have come up with disparities. We know our Latinx population and our Black African-American gay men population have been not receiving the access to vaccines as they should. Again, it's the same as in PrEP and same as in HIV, the same social disparities that we're seeing in COVID and HIV, we're staying here. So we've been trying to address those equities across all fronts at CDPH.
Great, thank you for that. Yeah, those are good listening sessions. So thank you for providing that information in the chat for folks.
Okay.
That's another avenue where people can
Yeah.
kind of advocate for what we need.
Absolutely.
So just so you know, our Leather Pride is going to be exactly 4 weeks from next weekend. It's the weekend of the 28th. So we are 4 weeks out. So hopefully the county can get a request in, and maybe, we've got the event next weekend and maybe another one, if not this weekend, then sometime during the week, because that would be ideal to start getting people at least get one shot. And then if we have vaccinations offered at Pride, which is the following week, people will be 20 to 28 days out and can get their second shot at the event, but they will come there. Because as we know, tens of thousands of people, descend into Little Palm Springs for this event. There'll be a lot of people mixing. And so if people have at least the protection of one shot and get their second shot there, we meet the criteria, as flawed as many of us think they may be. They are what they are. And so that way, we really have an opportunity to get people.
Right. And as soon as we get a response back, we'll set up a call and work out all the details. Logistics, and we'll set up a call with CDC. So, I mean, yeah.
Great, thank you. Yeah, and I'll mention this in an email, Jose, to you and Misty and Dr. C about that. They may already have some requests.
Yeah, I was going to say, Jeff, there is a Dr. Lou, L-I-U, who's we've been in communication with. So I'll find out when I can, and I'll let Misty know that you'll be reaching out as well.
Okay, and who's Dr. Lou?
I believe she is on the MPX task force.
Oh, for the state.
Yeah.
Okay.
Yeah.
Good to know. Terrific. Thank you. Okay. Are there any providers on the call from DAP, Borrego, PS Test, any of those places? Speak now or forever hold your peace. It doesn't sound like it. I think we need to reinforce with them that these are in lieu of the Thursday task force meetings that we have been doing. And then we told them that, but that's, and of course, getting doctors together is kind of like herding cats. So it's always a challenge and getting them on. I see a smile from Jose. And getting them to change their habits once they got in the habit of the weekly task force meetings may take a week or two. So I think we've covered a lot, and hopefully a lot of questions have gotten answered, and things are changing with the new eligibility broadening. So that should start to make a big difference. And it sounds like we have a path forward to getting some big events in the next week or two to get us people vaccinated before Pride. And then, so yeah, Stephen, you have a question.
Yeah, I'm just curious. It came up earlier about the intradermal versus the sub-Q injection and the effects that people could have. So I was at my doctor today, and I actually got a sub-Q injection because I happen to be a person who scars very, very easily. Not like cosmetic, like dangerously keloidal type of scars. And they were like, okay, we're giving you sub-Q. And it was in the questionnaire that they asked me. I didn't even ask for it. Is that, if I understand properly, you have to give a full dosage when you do that? Is that one of the reasons why, the intradermal actually multiplies the number of vaccines you can get out of a thing? So is that what's going on? And also, my doctor, my physician mentioned that there could be a possibility that people are having side effects like headaches and whatever, major fatigue the day after an intradermal shot, possibly because it does, you have to be skilled in giving that type of injection. But I just want to know your thoughts on that. And is it like an option if somebody said, I want a sub-Q injection? Is that even an option for somebody to request?
I know that there generally is criteria, as you mentioned, as to when the different versions are given. I did get a text because I asked that we have not gotten any reports that of any difference in the side effects of one shot versus the other. I got a text message about that because I asked during the meeting. I will ask again when we have our briefing on Thursday morning. But I think that we're not getting any reports of a separate one. And I will find out more about the specifics when and how the criteria is, because I asked the same thing before. Yeah. And it is if there's a history or a problem, like you mentioned before.
Well, we had done the Positively Aging Project Convention last Saturday, and there was somebody who asked, it was a person of color who said, has there been a correlation, because people of color very often have problems with keloidal scars? So I was just doing it. Like I said, I didn't even ask. It was in the questionnaire, and they made the decision to give me the other kind.
Yeah, and thank you, Stephen, for raising that, because I think it's important for people to know that's an option. They need it, but obviously, a vial, it used to be one vial per shot, doing it the old way, just straight into the arm, and doing it under the skin where it forms a little bubble, like a TB test. They can get up to 5 doses out of a vial. So obviously that's the reason why they're doing that whenever possible. And also because doing it that way elicits more of a local immune response, and that's why you get the big red welts and it's itchy and so forth. So it shows that it's working, so that's a good sign. But for a few of us, it became systemic, and we had the achiness and the headaches and so forth. For me, for about a week, but fortunately, people like that are a minority. But it's important to know. Like anything else, I think a lot of people had reactions to their subsequent COVID shots as well.
Right. I mean, my provider actually said, in some ways, you should be happy you have a reaction to it, as opposed to not, because it means your immune system's doing what it should be doing.
Exactly. Terrific. So any other questions or comments before we adjourn the meeting, and thank you, Jose, for being the point man.
Well, no, I appreciate that. Like I said, Misty and Dr. C normally are here, and they do an excellent job. But I'll work on it, see what we can do. Thank you.
Appreciate that. Yeah, and like I said, that information that Terry suggested, getting that report ahead of time may make your job easier, and hopefully they can be on subsequent calls. And for those who don't know, Dr. Chavinsky is one of the state public health or the county public health officers, and is a doctor. She's an MD. And then Misty, whom we keep talking about, Misty Plumley, is an epidemiologist with the county and is on top of all the data that people were asking about in terms of how many doses have been received and administered and that sort of thing. So between them, they can provide a lot of that information. So hopefully they'll be on subsequent calls. And if not, the form that Terry suggested will make sure that the information gets to us. So terrific. Anybody else? If not, thank you all for coming. Again, these will be every other week for the time being. So put that on your calendar and then watch your email inboxes for the reminders, and we hope to see everybody then. And thank you all for joining tonight.